Hello everyone, and welcome to the DPS Mental Health Medication Overview. This lecture is part of our DPS NCLEX Success and Clinical Competency Program. Today, we'll explore the most essential psychiatric medications tested on NCLEX, focusing on nursing responsibilities, patient education, and clinical safety. You'll learn not just what the drugs do, but why each point matters for nursing practice. Our goal is to help you confidently recognize key drug classes, anticipate side effects, and make safe, evidence-based decisions exactly the way NCLEX expects you to think. Let's begin by reviewing the main categories we'll cover today: antidepressants, mood stabilizers, antipsychotics, anxiolytics, and other high-yield psychiatric medications. Health promotion in mental health nursing means helping patients stay safe, informed, and emotionally supported. First, safe medication administration. Always follow the 6 rights, check allergies and labs, and monitor for side effects like dizziness or lithium toxicity. Safety comes first. Apply fall precautions and report any unusual symptoms immediately. Second, patient education. Explain how each medication works, when to expect results, and which foods or drugs to avoid. Use the teach back method to confirm understanding and remind patients never to stop abruptly. Finally, emotional support. Show empathy, listen actively, and create a non-judgmental space. Encourage coping skills and involve family when possible. Together, these 3 elements, safe medication, education, and emotional support, form the heart of psychosocial integrity and the foundation of safe, compassionate nursing care. Let's start with antidepressants, one of the most frequently tested NCLEX categories. There are 4 primary groups: SSRIs, SNRIs, TCAs, and MAOIs. SSRIs, such as fluoxetine, sertraline, and citalopram, block serotonin reuptake and increase its availability in the brain. They take about 2 to 4 weeks to become effective, a vital NCLEX point for patient teaching. Key side effects include GI upset, insomnia, and sexual dysfunction. Always assess for suicidal ideation, especially during the first few weeks. If a patient develops confusion, fever, tremor, or hyperreflexia, suspect serotonin syndrome and stop the drug immediately. SNRIs like venlafaxine, duloxetine can increase blood pressure. TCAs like amitriptyline cause strong anticholinergic effects: dry mouth, constipation, blurred vision, urinary retention, and orthostatic hypotension. Teach safety precautions. MAOIs like phenelzine, tranylcypromine require a tyramine-restricted diet to prevent hypertensive crisis. Patients must avoid aged cheese, red wine, smoked meats, and soy products. Allow at least a 2-week washout between MAOIs and SSRIs to prevent serotonin toxicity. Next, mood stabilizers, essential for bipolar disorder. The cornerstone drug is lithium. Therapeutic range is 0.61.2 MEQL. Toxicity begins at 1.5. Toxicity signs include coarse tremor, vomiting, diarrhea, confusion, and ataxia. If observed, stop the drug immediately and notify the provider. Teach patients to maintain consistent salt and fluid intake. Dehydration increases toxicity risk. Avoid thiazide diuretics and NSAIDs, which raise lithium levels. Monitor kidney and thyroid function regularly. Other stabilizers include valproic acid, carbamazepine, and lamotrigine. Valproic acid can cause liver toxicity and thrombocytopenia. Check LFTs and platelets. Carbamazepine may cause agranulocytosis and severe rash. Stevens-Johnson syndrome, especially in Asian populations with HLA-B1502. Lamotrigine can cause a dangerous rash. Report immediately. Now, let's discuss antipsychotics, another NCLEX hotspot. Typical first-generation drugs like haloperidol and chlorpromazine block dopamine, treating positive symptoms such as hallucinations and delusions. The key nursing concern is extrapyramidal symptoms: EPS. Acute dystonia, neck spasms, oculogyric crisis. Treat with IM benztropine or diphenhydramine. Parkinsonism, rigidity, and tremor. Treat with benztropine or amantadine. Akathisia, restlessness. Manage with propranolol. Tardive dyskinesia, lip smacking, tongue movement usually irreversible. Notify provider. Watch for neuroleptic malignant syndrome NMS, a life-threatening emergency with high fever, severe muscle rigidity, and confusion. Stop the drug immediately and provide cooling, IV fluids, and dantrolene or bromocriptine. Atypical antipsychotics, such as risperidone, olanzapine, and clozapine, treat both positive and negative symptoms with fewer EPs. However, they cause metabolic syndrome, weight gain, hyperglycemia, and hyperlipidemia. Clozapine requires regular ANC monitoring because of a granulocytosis risk. Patients must report any sore throat or fever immediately. Anxiolytics calm anxiety and promote sleep. Benzodiazepines like lorazepam and diazepam act quickly but can cause dependence and respiratory depression. Never combine with alcohol or opioids. The antidote is flumazenil, though it can cause seizures in chronic users. Buspirone is a non-benzodiazepine anxiolytic, ideal for long-term use. It's non-sedating, has no dependence risk, but takes 2-4 weeks for full effect, so it's not for PRN anxiety. Avoid grapefruit juice to prevent toxicity. For insomnia, Z drugs such as zolpidem are used, but teach patients about sleepwalking or amnesia risks and to take it right before bedtime. Now, substance use and ADHD, both common NCLEX areas. For alcohol use disorder, the main medications are: naltrexone reduces cravings, avoid in liver disease. Acamprosate maintains abstinence, watch for diarrhea. Disulfiram creates an aversive reaction with alcohol, flushing, nausea, low blood pressure, teach no alcohol, even in cough syrups or sauces. For opioid use disorder, methadone long-acting agonist, prevents withdrawal, monitor QT interval. Buprenorphine partial agonist, lower abuse risk. Naloxone reversal agent, essential in overdose. For ADHD, stimulants methylphenidate, amphetamine increase focus but suppress appetite and may raise BP, monitor growth in children. Atomoxetine, a non-stimulant, can cause liver injury and suicidal thoughts. Clonidine or guanfacine can cause sedation and hypotension. Taper slowly to avoid rebound hypertension. Education and safety are key to NCLEX success. Always emphasize 2-4 week onset for antidepressants and buspirone. Never stop antidepressants or benzodiazepines abruptly. For lithium, maintain hydration and consistent salt intake. For MAOIs, avoid tyramine foods. For clozapine, report fever or sore throat immediately. Safety first, use fall precautions for sedated patients. Monitor suicide risk during early antidepressant use, and check labs for hepatotoxic or nephrotoxic drugs. Let's connect it to the NCLEX. You'll see questions that test nursing judgment, not memorization. Examples include: which side effect requires immediate action? Answer: serotonin syndrome or NMS. What is the priority teaching point for MAOIs? Avoid tyramine. Which lab to monitor for valproic acid? Liver function, platelets. Which finding indicates lithium toxicity? Coarse tremor, confusion, diarrhea. Always choose the option that ensures patient safety, early recognition, and therapeutic communication. In summary, psychiatric medications demand careful nursing assessment, teaching, and vigilance. NCLEX emphasizes safety, prioritization, and patient education. Remember, knowledge prevents harm and compassion builds trust. You're not just managing symptoms, you're guiding patients toward stability and hope. Thank you for your dedication to compassionate, evidence-based nursing.